Hello, everybody, and welcome to the Physician's Mind podcast. My name is Curtis Wilkerson, and today we are joined by Dr. Richard Ling. This show is designed to interview medical students, residents, and attending physicians nationwide to get a gauge on their experiences along their journey. Dr. Richard Ling has a very impressive resume. He is currently an attending hospitalist at the Madigan Army Medical Center. He's a graduate of the Northwestern University Medical School. He did internal medicine residency at the Madigan Army Medical Center as an HPSP scholar. Once he finished his Army obligation, he was in private practice for 5 years before he went back to Madigan, and he's been there for the past 24 years. His responsibilities as an attending hospitalist include teaching residents and students and providing care for inpatients. He serves on GME committees. He's a clinical associate professor for the Uniformed Services University of Health Science, also known as USUS, and he is a clinical instructor for the University of Washington Medical School. Dr. Ling, I'm honored to have you on the show today. How are you doing?
Good. Thank you for having me, Curtis.
Of course. So we'll get right into it here and we'll just ask you the first question. So what does a day in your life look like as an attending hospitalist?
I'm on a compressed schedule where I work 2 weeks, 14 days, and then I have 14 days off. So I'm guessing that you want to know what my day when I'm working is like. I get into work somewhere between 7:30 and 8. Then I will pre-round on the patients with by going through their chart, looking at labs. If I don't have too much to do, I'll go down and attend morning report. And then at 9 o'clock, I will round with my team. We will typically round for about 2 hours, kind of discussing any new patients that we had, as well as the patients that we previously had, and kind of going over what has happened over the last overnight. And I give them the latitude to come up with their own assessments and plans. During rounds, I try and do as much teaching as I can, just because during the course of the day, one never knows how busy our day is going to be with admissions and other things that come up. So I want to make sure that we have some didactics. Typically, my teaching is based on the patients that we have, trying to talk about pertinent issues with the patients so that they get a better idea of, or they can remember better the things that we talk about. Obviously, trying to learn from a textbook is difficult. And what I found over the years is that if you can relate a particular problem or particular diagnosis to a patient, you're able to retain that knowledge a whole lot better.
Fantastic.
After we finish rounds, I will typically go to multidisciplinary rounds with my resident. I should say that my team usually consists of a senior resident, 1 to 2 interns, and 1 to 2 medical students. So we have a pretty full team. But after we round them, I go to multidisciplinary rounds with my resident, where we discuss disposition plans and plans with the various other services, physical therapy, occupational therapy. I have a nursing case manager that works specifically with my team. We'll also speak with the head nurses of each medicine ward, and maybe a pharmacist, maybe a nutritionist. And then after that, I start seeing my patients. That can take, depending on how busy our service is, that can take several hours. Interspersed with that, we may have admissions that we will be seeing. And then we just do our work for the day. I will typically go back and touch base with my team multiple times through the day, going over patients, studies, results that we have obtained, and talking, updating plans, running the list several times. typically my day ends anywhere between 5 and 6 p.m. and then I head home.
Fantastic. So you sounds like you had definitely have a very packed day, including going on rounds, instructing your team, and then seeing patients throughout the rest of the day. So another question I'd like to ask you is, what is some of the most interesting things that you enjoy teaching your students, or what is something that you found particularly remarkable that you've spent time teaching?
Uh, I try and base that more on what we have currently in our inpatient census. I typically do the bread and butter internal medicine topic. So more often than not, we'll have somebody who has come in with acutely decompensated heart failure. So there'll be heart failure teaching. Atrial fibrillation is another one that we oftentimes will talk about. COPD exacerbations, kind of the run-of-the-mill internal medicine topics. Occasionally we'll get something fun that we diagnose during the admission, and we get to work things like that up. The topic that internists always love to talk about or hate to talk about, depending on your perspective, is things like hyponatremia and acid base. So I always try and do that. I am kind of a numbers person, and so those kind of are right in my wheelhouse. And then, the other part of it that everybody groans and kind of rolls their eyes, but I do more because it's important for anybody that is practicing medicine. As you go through the years, you start to do your own critical reading and make your own decisions based on what you read in journals. And so biostatistics, I usually do try and talk about that occasionally with the residents and the medical students. It helps them for their standardized tests too, because there's always a biostats question, and there's not a lot you need to remember about it. But if you don't know it, you're not going to learn it in the middle of a standardized test.
Well said. Well said. You might as well learn it while you can when you're right in the thick of things.
Yeah.
So, on the topic of keeping up to date with clinical research, you mentioned you do reading a lot on your own, but are there any other ways that you stay current with the medical research and developments within internal medicine?
I think that the one of the biggest benefits that I have in terms of teaching residents and students is that I have to stay current. Both through journal articles, looking stuff up. Kind of found that when I was in practice, it was easy to go through seeing patients day after day, and then at the end of the day, it's like, well, done with my day, going to go home, be with my family, do things with my family. And it's easy to do that over and over and not take the time, other than the mandatory CME that you need to do every year. You can kind of fall into a rut. And with residents and medical students who are always trying to learn things, and I have residents all the time that are bringing me, well, did you hear about this study? Did you see this article? It forces me to stay current, both through looking stuff up on my own, reading journal articles, getting updates, and listening to my residents. I don't go to many meetings. Oftentimes, again, because my schedule is a compressed schedule, I don't have, for the most part, the luxury of picking and choosing when I'm going to be off. Although I do have some vacation time, it's more of, if I'm off for 2 weeks and a meeting would happen to fall there, I might decide to do that. But most of the stuff is done on my own.
I see. Well, very good. It's important to keep up to date, and it sounds like you do a fantastic job of doing it as an instructor and a physician. So let's talk about your Army service. So when you were a medical student, is that when you decided to enroll in the HPSP scholarship, or was it prior to medical school?
It was actually My first year of medical school. My sister was already in medical school, and my parents felt that it was their responsibility to pay for our education. And after looking at my tuition bill and realizing that it was times two for my parents, I tried to come up with a better way to afford medical school where I could pay for it, where my parents didn't have to pay for it. And so I looked at the various opportunities, and I thought that getting an HPSP scholarship would be something that I could do. It was something that wasn't going to impact me negatively from a lifelong medical career, and I could be of service to the military, the United States, for as long as they needed me. So I
Fantastic.
applied for a scholarship and got a 3-year scholarship.
Very good. Well, as always, we appreciate your service. Thank you for your service. And we're going to talk more about that later. But another thing I wanted to ask you was your choice your choice of matching into internal medicine and pursuing that path. Were you always interested in that specialty, or were there any other specialties you were interested in, or was it always internal medicine for you?
That's a great question. Like about half of my medical school class, I wanted to go into orthopedic surgery when I first got into medical school. At the time that I was in medical school, arthroscopic surgery was just starting to become a really big thing. And I thought it would be a lot of fun to be able to do, knee arthroscopies and all that other stuff that comes along with that. And I was always interested in sports, and that kind of fit right exactly what my interests were. Taking care of athletes, and doing arthroscopies and other orthopedic procedures. And what I very quickly found out was I didn't have the mechanical ability to figure out things from an orthopedic standpoint. I think if you're, I'd never done a lot of stuff with my hands. I think if you're really good with your hands, you do woodworking, that kind of stuff, it fits right into what you want to do. But for me, it was something that was pretty foreign to me. But then I still wanted to be a surgeon. So then I thought cardiothoracic surgery would be something I want to do, because I was always interested in the heart. And after watching some cardiothoracic surgery, I was like, well, this is interesting. It's not, it wasn't anything that really set me off in terms of, really piquing my interest. And so I kind of thought, well, maybe I want to be a cardiologist instead, just because I enjoyed, I still like the heart. But decided that I was going to allow my experience in general surgery and internal medicine decide which way I was going to be, whether I was going to be a surgeon or not. What I found out was when I did my general surgery rotation, there were plenty of my classmates that loved to go to the operating room. Me, not so much. I actually enjoy taking care of the patients that were on the wards, whether they were post-op or pre-op patients, more than I did going to the OR. And that's when I realized that if going to the OR is not something that I wanted to do over and over every single day, then maybe surgery wasn't for me. And that's how I decided internal medicine.
Very interesting.
So it was kind of a long, convoluted way to get to medicine. And it's completely different from what I had thought about when I first thought about going into medicine.
Sure. Yeah, and I'm sure that's a very common path for a lot of medical students. They go in, and I've heard this from other physicians before. They have students that come in, they're interested in one particular specialty, and they learn more and more, and they kind of are exposed to different things, and they discover, well, like in your case, well, I don't necessarily like being in the OR, but I enjoy taking care of patients in that medical respect from the medical internal medicine standpoint is what I'm trying to say. But very interesting pathway. Interesting to hear how you came from wanting to go into orthopedics and discovering over the years of medical school why you were interested in internal medicine more so. So the next question I would ask you is, what do you recommend for the incoming medical student who maybe doesn't quite know what they want to specialize in, or maybe they're interested in a particular specialty, but they want to keep their options open? What would you recommend for them just to succeed in general?
I think the biggest thing is to keep an open mind. You have to chase your passion. You can't base what you want to do based on a lifestyle issue. For a bunch of years, not as much anymore, but probably about 10 years ago, people were choosing all the lifestyle specialties, wanting to do more shift work kind of things. And people talked about, yeah, I want to go in the emergency department because it's shift work, and once I'm done, I'm done. I don't have to worry about it. And I think that's you can succeed and you can be relatively happy in a specialty if you choose it because of that. But the thing that's going to get you up every morning and want to go back in the hospital, want to go back in the clinic, is something that you're passionate about. If you really enjoy doing something, it's not going to be a big deal to get up and go to work. If you're doing it just to put the time in, it's going to be a struggle. And I think that the biggest thing is, keep an open mind if you're a medical student. Don't automatically think that, well, because I like this is what I want to do. And have that cloud your overall decision. When I was in wanting to be in orthopedic surgery, I had a mentor who was fantastic. He was the kind of doctor that I thought I wanted to be. He was really good. He was really personable. He did kind of a sports fellowship, and so he did knee arthroscopies and other procedures on the professional athletes. I remember right before Thanksgiving, I was in the OR with him, and one of the nurses stuck their heads in and said, well, when do you want to meet with Dr. Curlin and Job, because they're coming in. The Los Angeles Rams were in town to play, and Curlin and Job were the team physicians. And the mentor that I had said, yeah, I'll meet with them for dinner on such and such a date. And so I thought, well, that's really cool. That's what I want to do. But then what he kind of, his schedule consisted of doing the arthroscopies at Northwestern a couple days a week, working at Cook County Hospital 1 day a week, and doing a sports medicine clinic 1 day a week. And I thought the sports medicine clinic was really a fun thing to do. And he said, well, I don't really like taking care of the worried well as much. It just is kind of simple things, and it's not very fulfilling. What was most fulfilling to him was working at Cook County, where he was working pretty much without being paid. And he did it because it's what he enjoyed to do. It's like, those people actually need the services. They can't afford the services, and so we do them for them. And that was the most fulfilling thing for him. And that's what it made me realize, that all the fun stuff that you see on TV and all the glamorous stuff, it may not be what is everybody's passion, and it's passion. It was more, what I enjoy more is taking care of people and making a difference, and really enjoying what I do at the same time. So, that's kind of been what keeps me going for as long as I have been.
That's phenomenal. And definitely a great way to do it, by taking care of those patients directly. And you can probably feel very frequently that you're making a positive impact on your life. And that's really good. That's really fantastic to have that drive within you. So what would you recommend for, I want to ask you a couple questions again about internal
Mhm.
medicine. First one is, what sort of recommendation would you have for the student that's interested in internal medicine? And what do you think makes a successful internal medicine physician? Like, what are the successful traits of one?
Boy, I think that I always joke that if you like solving puzzles, if you like crossword puzzles, those kinds of things, you're probably the person that whose personality fits internal medicine. We don't, if unless you're in a procedure-based subspecialty, we don't do a whole lot of procedures. What we get paid for is thinking and trying to problem solve and realizing that the other specialties count on you to actually take care of their patients. A lot of we do a lot of primary management of surgical subspecialty patients that have been admitted, but they're very complex. And so the surgeons, mostly because I don't think they want to, ask us to manage the complexities of the patient's other medical issues while they take care of the surgical problem. And I think the personality of an internist is, yeah, somebody who just can go about things in a very systematic manner, doesn't get overwhelmed by the complexities of a patient, and takes each problem as a challenge, one that
Hmm.
you can fix, that you can, I guess, not necessarily fix, but make better. I interviewed a job once that they said, well, we have really complex patients. Some of them have high blood pressure, diabetes, and high cholesterol. And I kind of looked, I guess I had a funny look on my face. And he said, well, for an internist like you, that's just kind of bread and butter, easy stuff. But for most people, that's difficult. And so I think that that's the best way to look at it. It's the person that likes dealing with a complex patient, dealing with problems 1 through 10, um, and is able to systematically figure things out, is the person that's going to be best served going into internal medicine.
Okay, so somebody who's very systematic, very problem-solving oriented, someone capable of managing a lot of different complexities at one time, and perhaps even enjoys that is the person
Yep.
who should consider internal medicine. Very good. Okay.
Yeah.
So moving on to some more of your Army experience, could you please describe some of the pros and some of the cons in your experience as a Army physician scholar?
Uh, I don't have anything bad to say about the military. The Army treated me great. Um, I think that the benefits of being in the Army is or any of the armed services for that matter, is you practice in a system where you do worry some about cost, but you're not directly dealing with cost and things like insurance issues all the time. You get to actually take care of the patient. And that was one of the big attractions to me about being in military medicine, is you can actually do the right thing without having to worry about cost. That can be a double-edged sword. I've had any number of patients come in and say, I just want to get an MRI to see if anything's wrong. It's like, well, you're asking for, $1,000, $1,500 test just to look.
Hmm.
And that's not necessarily very cost effective. On the other hand, it's true, we can do that without having to worry about how much it's going to cost the patient. I just had a family member who said they were going to go in, they were ill and they were going to go in and see their primary. And they went to see the primary and said, well, they think I have a pneumonia. I said, well, what did the lab show? And the response was, didn't get any labs. And I kind of scratched my head and I thought, well, if it were me, I would have ordered several of the tests. And her comment was, well, that's what you get when you're, private practice having to pay for things.
Wow.
So, so I do think that to me that's the benefit of military medicine. One of the benefits. The other thing is that the other benefit of military medicine is you get to do things that most people wouldn't even dream about doing. I have seen residents that have wanted to go work for special operations groups. Most of the military physicians get deployed. And so you get to really do kind of field medicine that other people wouldn't get that opportunity. If you want to jump out of a perfectly good airplane, you do have that ability to do that. You can, I know that a lot of my peers when I was in as an intern, they had gone to a tropical medicine course. Something that you don't get if you're in if you're not in a military residency. So there's a lot of opportunities for that. There are, Army and military headaches. You have to do some things that most people don't. But as long as you realize that and take that into account, it's not a bad thing. So I said, the Army treated me very well. I had a great time. They let me do a bunch of stuff, and didn't hassle me with any of the administrative stuff because as an internist, I color within the lines. I cross T's and dot I's. And so all the military specific training that I had to do, I did. And so they left me alone.
Very good. So Army, cost-effective care, plenty of opportunities to go on deployments, experience some field medical techniques, and like you said, you're well taken care of, or at least in your case, you were well taken care of. So that's amazing that you had that opportunity. Another thing, what was one of like the coolest experience you've had being an Army doc?
Um, I didn't get deployed because of the fact that when I was in residency was when the first Desert Storm was taking place. And so they didn't take residents out of training to go to support Desert Shield, Desert Storm. For me, one of the fun things I did was I went to an Army survival course. And so it was a voluntary thing, and we got to basically do all the things that a combat unit had to do, but we did it as volunteers rather than being, kind of told that we had to do them. And so it was a different perspective. The cadre of instructors thought we were a little bit different because we were all choosing to be there, to be out in the field, running around, rappelling, doing all that stuff. And it wasn't our job. It was what we did to just as a way of, I guess, proving that we couldn't do it.
Yeah.
So that was a lot of fun for me. It wasn't anything where I specifically did any medicine. It was just learning kind of what soldiers had to do. And so that was fun for me.
Yeah, and that's good. That gives you some good perspective, perhaps, into what the life of the general soldier may look like, which can help you out as you care for those patients. So, very good. We've discussed some of the pros and cons of being in the Army. What are some of the pros and cons of being an internal medicine physician, whether that's lifestyle, whether that's some bureaucratic requirements in the system work? What are some of the pros and cons that you've experienced?
As a military physician or as a internist in general?
Outside of the military, internist in general.
Okay. I think that as an internist, because we don't do a lot of procedures, we don't get compensated as well as the big procedure-oriented specialties. I think a lot of the subspecialists in internal medicine, the cardiologists, gastroenterologists get compensated better because they're doing procedures. But until the healthcare system decides to reward people for their thinking, and not for doing things. We will always be one of the less well compensated group of physicians. That's one of the cons. The pros are, when there's a real problem with patients, when patients are doing really poorly, that we're the ones that they ask to come sort it out. And I guess what's rewarding is when we can actually sort it out and figure it out and give people a good plan and patients get better. That to me is the most fun. Seeing, and I think for me, I'm currently a hospitalist, so I don't have a clinic and I don't see patients on a regular basis. But when I was in a primary care clinic, it was a lot of fun having continuity with my patients. I had the same patients, some of which I had for 16 years. And in the military system, that's unheard of. Nobody has had the same physician for 16 years. And so I got to know the patients really well. I got to help them live a life outside of the typical hospital system. I always tell my residents that when you see patients in the hospital, that's not what they're like in real life. When you see people in the clinic and they're coming in from running their errands. And I remember having a patient that said, you need to hurry up because I've got an 11 o'clock tea time. And so it was my job to get him out and, back out so he could go play golf. And keeping them healthy enough so that they could do those kinds of things and live their lives and connect with patients was really one of the more rewarding things for me as a general internist, being their primary care provider and trying to do a good job of keeping them going. I take care of an aged population, and so if you do the math, if I started seeing a patient when they were 65, when I left they were 81, and I had lots of 80 and 90-year-old patients that I was seeing on a regular basis, and helping them maintain their health and allow them to do the things they want to do was very rewarding.
Amazing. And I think that's something that most physicians can agree upon as being one of their primary motivators, is just knowing that you have that positive impact and connection with patients, whether it's for a very long time or for a short period of time. That's one of the most appealing aspects of being a medical practitioner, I'd say. So my next question for you, Dr. Ling, is what does your work-life balance look like? What kind of hobbies are you interested in outside of medicine? What are you doing when you get home after that shift at around 5 or 6? What are you doing on the weekends? What are some of your hobbies?
For a long time, I did endurance events. I was a triathlete for a number of years. And that's also one of the reasons I think I was attracted to internal medicine was, learning about physiology and learning how to be an athlete as well, and kind of understand the science behind being an athlete. And so for a lot of years, I was a triathlete. And then as everybody else does, I got old and I slowed down. Little injuries became bigger injuries, and decided that I couldn't compete anymore. So I still try and remain fit. I still swim several days a week. I ride my bike as much as possible, and I run occasionally. Started playing more golf. My wife also enjoys golfing, so we spend a lot of our downtime playing golf. We have a couple of dogs we enjoy spending time with, and just have two sons who are grown, and one of them was living at home and he moved out, and the other one moved home after graduating from college, and he's trying to sort out his life. And so having them around has been a lot of fun. So I spend a lot of time with family. My wife likes to cook, so I like to eat. That's another one of my hobbies.
Awesome.
And that's it. Just enjoying my life.
Yeah, that's about the best you could do right there. Stay fit, enjoy the family time, get out on the golf course occasionally. That's awesome. Couple dogs in there too. So very good. It's important to have that kind of stuff outside of your work. It can't be all work. But back to the topic of work. Oh, actually, before we go back to the medical thing, you're wearing an Ironman jacket, and I want to ask you, how many Ironman events have you successfully finished? How many have you competed
You're not supposed to see that. I was trying to hide that, but it's kind of
in?
cool down here in our basement. I've done 2 Ironmans.
That's awesome.
Um, and I don't know if you can read it, but this is from a time that you may not have even been born. So it's old. It's older than my youngest son.
I may not have been born. I may not have been. If it was before like 2002, probably was before my time.
Yeah,
So
this is older than you are.
for those of you who don't know, the
I
Ironman.
found I couldn't. I never figured out the Ironman. The distance was I just couldn't figure it out. So I did better on shorter course.
And that's just fine. Knock out a couple of those and just do the shorter ones and just stay healthy and stay happy instead of just being on that
Yeah.
bike for long, miserable sessions. So
Well, you
very
know that
awesome.
well too.
Oh yeah, we've been there once with me and my buddies in college, and it was long training sessions, long weekends. So, but that's very impressive to have finished any number of those, and having done two is very awesome in my opinion. But so let's on the topic actually of things that we're proud of accomplishing. Can you share a moment where you felt particularly proud of your work as a physician?
Uh, I think for me, um, the best feeling I have is when I'm with residents or students and I see the light go on when they get something or they figure it out is really when I have the most fun. When we're talking about something and it's almost like they look at me and say, I get it, and they can figure it out. So, for me, the accomplishments are that I've been recognized for it. At various times I've gotten outstanding teacher awards. Those to me are the more rewarding than anything else. I think that both being recognized by my residents and the students is probably more important than it is being recognized by my peers, because it tells me that the way I'm doing things is something that is appreciated, and is helping guide a future doctor.
That's really cool. Yeah, and I know that feeling you're talking about when that light comes on and you have that aha moment, you're like you learned something and you could see it. And that must be very fulfilling to kind of know that you're having a role in that process. So what are some of the misconceptions that some people have about your specialty?
Well, I think if I tell people I'm an internist, some people say, well, what is that? If I tell people I'm a hospitalist, some people say, well, what is that? And then for the longest time, it was like, oh, you're an internal medicine doctor. So you do like general practice, or you do family practice, and it's different. We take care of adults only. It's primarily what we're trained to do. We're good at, again, taking care of complex adults, and other than that, I don't know that there's a whole lot of misperceptions, other than trying to figure out what niche we fit into. And the question will come in: how is an internist different from a family medicine doctor? And my response has always been, well, the family medicine doctor learns how to do OB and learns how to do pediatrics, and they spend time doing kind of bits of everything, and we focus only on adults. And so if you're an adult with, medical conditions, and even if you don't, I think that the best person for you, as an adult, is to see an internist, because they're going to figure things out probably better than anybody else. They're the best. We kind of think of ourselves as the best diagnosticians around, that we can come up with answers when nobody else can, that we can tie multiple systems and symptoms together to one unifying diagnosis better than anybody else.
Very cool. Very cool. Is there a stereotype for an internist, just like there's the gym bro stereotype for an orthopedist?
Well, one of my nurse practitioners called me a nerd, and haven't been called a nerd in a long time. But in truth, it was because I told some physician or internist joke, and she just kind of looked at me and said, "You really are a nerd, aren't you?" So I guess that's kind of where we are. Is where we spend a lot of time perseverating over little things. The joke is, we care more about numbers, electrolytes and things than anybody else does. Is who really cares what somebody's sodium is? And it's like, well, we do. And I think that that's the biggest stereotype, is where we're very particular. We do the minutia, but that's kind of what makes an internist a good one, is if you pay attention to all the little things.
Absolutely. Well, Dr. Ling, so far we've kind of discussed what a day in your life looks like, your path to becoming an internal medicine doc, the stereotypes of an internist, some of the pros and cons of the Army, and the pros and cons of your specialty. So one of the last questions I want to ask you is, could you describe a valuable lesson learned that may be beneficial for any student, resident, or physician?
Yeah, I mean, I guess it goes back to my dealings with this orthopedic surgeon, who was one of my first mentors, is, thinking about what your role is, and, how, again, the biggest thing is helping people, learning how to be a good doctor, and chasing your passion. Whatever your passion is. Some people look at me and can't believe how I could be an internist. Just like I look at other people and have no idea how they can do what they do. But I think that if you do have a passion for something, again, it's something that you're never really going to think you're working that hard for. And they always say that if you're passionate about something, passionate about your work, you're never working. And I know that my schedule is a compressed schedule, and so I do have time off. But by about halfway through my time off, I'm ready to go back to work, and I'm anxious to go back to work, anxious or excited to go back to work. And so that's what I think you have to do, is you have to find the thing that gets you up in the morning. And, if you do that, then you'll always be happy doing what you do.
Well said. A valuable piece of advice for medicine and beyond. Find what you're passionate about, and you won't work a day in your life. Ladies and gentlemen,
right.
We've been talking with Dr. Ling. Thank you for tuning in. Dr. Ling, thank you for being here.
Appreciate it, Curtis.